Hispanic Culture, Healthcare Implications by Sal Ayuzan. Introduction. According to the CDC, as of July 1st, 2013, approximately 54 million Hispanics live in the United States, which is 17% of the total population. It is predicted that the Hispanic population in the United States will double by 2050. Cultural insensitivity negatively affects care. It is essential to be aware of common Hispanic practices and beliefs in order to provide effective, culturally competent care. Hispanics include any person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish cultural origin regardless of race. Cultural attributes include that they are family and group oriented, they're traditionally patriarchal in structure, the father or the oldest male relative has the greatest power, and women are expected to show submission. They rely on family and extended family networks. They're collectivistic in culture. Their group activities are dominant. Responsibility is shared and accountability is collective. Harmony and cooperation among group tends to be emphasized more than individual function and responsibility. Health to Hispanics mean good luck or reward for good behavior, and if they have poor health, then it's often attributed to empacho, which is essentially a dislocation or an upset stomach or indigestion caused by eating the wrong food at the wrong time of the day, or eating undercooked food or swallowing gum, which is often treated by rubbing the stomach or back gently with cooking oil and pinching the spine. Mal de ojo is bad eye. It's caused when someone looks with admiration or jealousy at another person. The only treatment that they have is to say a prayer while passing an egg over the victim's body and placing the egg in a bowl under the victim's bed overnight, or having the person who caused the mal de ojo care for the victim. Envidia means envy, and it causes illness and bad luck. It can be provoked by success, which can result in misfortune and illness. Low socioeconomic status is often associated with a belief in envidia. Susto is fright sickness, which arises from traumatic or frightening experience. It's thought to cause soul loss, where the soul leaves the body and wanders freely. Symptoms include anxiety, depression, insomnia, introversion, irritability, lethargy, and anorexia. An example of susto is tuberculosis. They also believe in the hot and the cold system, or wet and dry, where physical and mental illness is thought to result from an imbalance between the person and their environment. It's often corrected by consuming foods or herbs with the opposite quality, while cold conditions are treated with hot medications, and wet conditions are treated with dry medications, or vice versa. Religion is also a very influential attribute for the Hispanic culture, particularly for Roman Catholics. They believe that if they are sick, it is God's will, and this often delays appropriate preventative care for the Hispanic population. Health care for Hispanic children from 0 to 17 years of age. This shows that children have less availability to health care. Parents often report that children have poor health or fare to poor health. First-generation Hispanic kids are less likely to be insured. They have worse health, and they're also less likely to visit their doctor or have a primary health care provider. Hispanic children with a lack of health care are more likely to become ill with any illness that may negatively affect the remainder of their life. When caring for Hispanic children, it is important to assess for any vaccinations received and herbal remedies that their parents may have used to treat them, and be aware of the degree of family involvement. Healthcare for Hispanic adults, 18 to 64 years of age. The entire family comes to the doctor's office or the hospital. They're a very close-knit group. The male is the dominant figure in the family. All members are involved in the care, but the father makes the final decision. Also, when addressing the family and the patient, it is important to address the family with respect. It is considered disrespectful to have a lot of eye contact when dealing with a family. Women understand that the husband is the boss and therefore follow what he says. Because of this, it is important to observe for domestic violence when caring for the female patient. Adults typically only seek health care after trying all the remedies provided by families and the neighbors. The use of cultural folk medicine, remedies and healers, neighborhood women, naturalist shops for naturalist doctors, and naturopaths, and prayers and healing are also often employed by the Hispanic adults. Healthcare for Hispanic older adults, 65 years and older, they expect respect from everyone. There is a rise in the population of older Hispanic adults, according to Livingston, Minushkin, and Kohn. Healthcare providers need to be aware of this increase in order to prepare to provide for the increased amount of patients. The Hispanic elders expect respect from everyone, and they are seen to have more wisdom. Older adults are at risk for more chronic conditions because they are less likely to go to the doctor. They're also less likely to control their diabetes, receive vaccinations, receive cancer treatments, and other preventative care. Older Hispanic patients need further education on treating their current diseases, and they also need local community resources to do outreach and get involved in their care. They tend to like to get together or contact their family more than older adults in other cultures. Healthcare for childbearing women and their families include the mother of the patient, of the pregnant client, is often present throughout the labor process. The husband comes after the delivery. Labor is considered a woman's job. The delivering mother often looks up to the older ladies in the family, including the mother, grandmother, and aunts. It is understood that these women are full of advice and wisdom for the delivering mother. Older generations, especially those in rural areas, prefer to have babies at home, with midwives only present at the birth. Typically, the delivering mother does not take any medications during the pregnancy or delivery. It's thought to have a negative effect on the baby. Pregnancy is also considered a hot health issue, which is treated with ice packs or cold remedies. They do not typically use sitz bath. This is important for labor and delivery nurses. After the birth, the placenta is often taken home and planted under a tree. It is believed that this will help the child grow the fruit of the tree. The mother and the baby also stay home for 40 days, with limited visitors to limit infections and provide ample time for proper bonding. Cloth diapers are favored over plastic or disposable ones because the plastic or disposable ones are considered bad for the baby's skin. The baby is also kept warmly wrapped with socks at all times to keep from getting chills and also to simulate the prenatal environment. Healthcare for Hispanic communities. It is noted that they rely heavily on family, friends, neighbors, and the church for health information and support. The neighbors protect from negative situations and decreased communication costs because of shared culture and language. Home remedies are passed down from generation to generation and from neighbor to neighbor. Television and radio has been shown to be the best ways to reach the Hispanic population. Community support in the Hispanic community has caused a decrease in the non-health benefiting behaviors like smoking and dangerous behaviors. In conclusion, the Hispanic population is growing fast. It's expected to double by 2050. There are many cultural beliefs to be knowledgeable of when dealing with the Hispanic culture. The Hispanic culture has much support from family, friends, neighbors, church, and community. They view health as hot or cold, wet or dry, or the result of karma. There's a need for healthcare services to be provided in multi-language platform. And there's also a need to explore how cultural perspectives, language barriers, and immigrant status are associated with reporting of illness and health status. As healthcare professionals, we need to increase our cultural knowledge to provide excellent care to Hispanic culture. And here is a list of my references. Thank you very much for listening.